In this lecture, I am going to talk about tetracyclines, the classification, pharmacokinetics, mechanism of action, the therapeutic uses based on the antibacterial spectrum, and some of the adverse effects, precautions, contraindications related to the use of tetracyclines. Also, I will be speaking about Tigecycline, a glycine cycline antibiotic, a newer tetracycline analog. So let's start with the classification of tetracyclines. Tetracyclines can be classified into three groups according to the duration of action. Group 1 includes tetracycline, oxytetracycline and chlortetracycline. It has a duration of action of 6 to 8 hours. The second group includes demiclocycline, which has a duration of action of 12 hours, which is more than that of older tetracyclines. And as we go higher, the third group includes doxycycline and minocycline. So these antibiotics, these tetracycline derivatives have a longer duration of action of 16 to 18 hours. And lastly, there is a new class of synthetic tetracycline analog which is known as Tigecycline. This has a duration of action of 36 to 60 hours. Now coming to the pharmacokinetics of tetracyclines, which comprises of absorption, distribution, metabolism and excretion. With respect to absorption, the older tetracyclines are slightly water soluble and doxycycline, minocycline are more lipid soluble. Now since the older tetracyclines are slightly water soluble, the intestinal absorption is incomplete and it is affected by food, so they are absorbed better in empty stomach. Whereas doxycycline and minocycline are more lipid soluble, so absorption is better in the intestine. It is not affected by food. Secondly, tetracyclines have the property of chelations. They form complexes with cations such as calcium, magnesium, aluminium, and therefore the absorption can be affected by milk, iron preparation, antacids, sucral fate affects the absorptions of tetracyclines by forming chelating complexes, and these are unabsorbable, insoluble complexes in the intestine. Next, tetracyclines have a large volume of distribution. They get distributed in the liver, kidney, spleen, connective tissue, teeth and bone, and adipose tissue. Minocycline is highly lipid soluble and it gets accumulated in the fat and is slowly released into the circulation, and this attributes to its prolonged half-life. Next is metabolism and excretion. Most tetracyclines are eliminated through the kidney by glomerular filtration, and therefore dose needs to be adjusted in renal failure. The exception is doxycycline, which is partially eliminated in bile and it undergoes enterohepatic circulation. Because it undergoes enterohepatic circulation, it has a longer duration of half-life. Now, since doxycycline is excreted as a conjugate in feces, it is not dependent on the kidney for elimination and therefore dose adjustment is not needed with doxycycline. So doxycycline is a safer option for treating infections in patients with chronic kidney disease. So these are the key features related to pharmacokinetics of tetracyclines. Now let's understand the mechanism of action of tetracycline. Tetracyclines act as bacteriostatic agents, which means that they inhibit the growth and multiplication of bacteria. So how do they work? The figure shows the mechanism of action of tetracycline. In gram-positive bacteria, tetracycline enters into the cytoplasm by an energy-dependent active transport system. So there is a carrier system which helps in the transport of tetracycline into the bacterial cell. In gram-negative bacteria, there are porin channels that are expressed in the outer membrane of the bacterial cell wall. So through these porin channels, the tetracycline passes by passive diffusion and then through the active transport mechanism, it enters into the cytoplasm. Now once tetracycline is inside the bacterial cell, it binds to the 30S ribosomal subunit to which the messenger RNA complex is attached. By binding to the 30S subunit, it inhibits the attachment of amino acid transfer RNA to the acceptor site in the 30S ribosome. So it inhibits the attachment of amino acid transfer RNA to the ribosomal messenger RNA complex, and this prevents the further addition of amino acids to the peptide chain. So the peptide chain fails to grow and this causes termination of protein synthesis. So tetracyclines, by binding to the 30S ribosomal subunit, inhibits the attachment of amino acid transfer RNA complex to the ribosome, thus inhibiting the growth of the peptide chain, prevents the addition of further amino acids, and this causes termination of protein synthesis and inhibits the growth and multiplication of bacteria. Now, speaking about the antibacterial spectrum of tetracyclines, these are broad spectrum antibiotic, which means that they are effective against a wide range of microorganisms. They are effective against atypical microorganisms, gram-negative bacteria, gram-positive bacteria, and spirochetes. Now, the atypical microorganisms include rickettsia, chlamydia, and mycoplasma. The gram-negative organisms are Vibrio cholerae, Yersinia pestis, Brucella are some of the gram-negative bacteria. Now, some of the examples of gram-positive bacteria are Clostridium, Bacillus anthracis, Listeria, and Actinomyces. And lastly, spirochetes include Treponema pallidum, Borrelia, and Leptospira. So now that we are familiar with the antibacterial spectrum, let's discuss the therapeutic uses of tetracyclines. They are highly effective for treating infections caused by atypical microorganisms. Some of the rickettsial infections are typhus fever, Rocky Mountain spotted fever, and Q fever. Chlamydial infections are trachoma, psittacosis, pneumonia, and lymphogranuloma venereum, LGV, lymphogranuloma venereum, and ulcerative genital infection which is caused by chlamydia. This responds to tetracycline treatment. Tetracyclines are also useful against mycoplasma pneumoniae, which is a common cause of atypical pneumonia. The next category of infections where tetracyclines are effective are infections that are caused by gram-negative bacteria. For example, cholera, which is caused by Vibrio cholerae, where tetracyclines reduce the volume of the stool and duration of diarrhea. Tetracycline is also effective in plague, which is caused by Yersinia pestis. Both bubonic and pneumonic plague responds effectively to tetracycline. Next is tetracycline is highly efficacious in the treatment of brucellosis, and the therapy of choice is doxycycline and rifampicin. So combination of doxycycline and rifampicin is preferred in the management of brucellosis. Next is peptic ulcer, which is caused by H. pylori, where tetracycline is used as an adjuvant drug. Also acne, which is caused by Propionibacterium, which is highly sensitive to low doses of tetracycline when used for prolonged period. However, there are other simpler treatments for the management of acne. It is also effective for the treatment of tularemia, which is caused by Francisella tularensis. So tetracyclines highly effective against gram-negative infections, and these are cholera, plague, brucella, peptic ulcer, acne, and tularemia. Now the next category includes infections that are caused by gram-positive bacteria, and these are tetanus, which is caused by Clostridium tetani, anthrax, which is caused by Bacillus anthracis, listeriosis, which is caused by Listeria gram-positive bacteria, actinomycosis, which is characterized by thoracic and abdominal lesions, and it is caused by Actinomyces israelis. Now the next category is the infections caused by spirochetes, and these include syphilis, which is caused by Treponema pallidum, Lyme's disease and relapsing fever, which is caused by Borrelia, and leptospirosis, which is caused by Leptospira species. So leptospirosis is characterized by neurological involvement, hepatic involvement, kidney involvement. It is also known as hepatorenal syndrome or Weil's disease. So the next category of infections is sexually transmitted diseases or STDs, where tetracyclines have a role. In the management of syphilis, penicillin is the drug of choice, and ceftriaxone can be used as an alternative to penicillin, and tetracyclines can be used as a second choice drug to ceftriaxone. Now in the management of chancroid, which is caused by Haemophilus ducreyi, tetracycline is the second choice drug to ceftriaxone. In the treatment of gonorrhea, which is caused by Neisseria gonorrhoeae species, tetracycline is again a second choice drug to ceftriaxone in the management of gonorrhea. Another ulcerative genital infection is granuloma inguinal, which is caused by Klebsiella granulomatis, and it responds to tetracycline treatment. In this way, tetracyclines play a role in treating infections that are caused by atypical microorganisms, gram-negative bacteria, gram-positive bacteria, spirochates, and a group of sexually transmitted diseases where tetracyclines play a role. Now let's discuss the adverse effects of tetracyclines. The first one is gastrointestinal side effects, and the symptoms are nausea, vomiting, epigastric pain, diarrhea. So tetracyclines have an irritative property, and diarrhea can occur because of irritation to the intestine. It can also occur because of superinfection, because tetracyclines are broad spectrum antibiotic and they cause marked suppression of the resident intestinal flora, and this leads to overgrowth of microorganisms such as chlamydia, proteus, pseudomonas, and this can lead to diarrhea. So diarrhea needs to be distinguished from irritative diarrhea and superinfection. Also, because of irritative property, tetracyclines can cause thrombophlebitis when injected intravenously. When injected intramuscularly, it can cause irritation in the tissues that is extremely painful. Therefore, intramuscular injections are avoided with tetracyclines. What are the other types of toxicities that are associated with tetracycline use? These are phototoxicity, vestibular toxicity, hepatotoxicity, and renal toxicity. Phototoxicity is caused by demiglocycline and doxycycline. It is a sunburn-like reaction in the skin in the exposed areas when exposed to sunlight, and also pigmentation in the nails can occur. Vestibular toxicity is characterized by symptoms of vertigo and ataxia, and this is caused by the accumulation of minocycline in the lipid-rich cells of the inner ear, and this causes symptoms of ataxia and vertigo. So minocycline, highly lipid soluble, gets deposited in the inner ear, leading to vestibular toxicity. The next type of toxicity, that is hepatotoxicity, this is particularly seen in pregnant women. When tetracyclines are administered, it can cause fatal acute hepatic necrosis. So it is contraindicated in pregnancy. Next is renal toxicity. As we know that tetracyclines undergo rapid elimination through the kidney. So in kidney disease, tetracyclines accumulate to toxic levels. Next is renal toxicity. As we know that tetracyclines undergo rapid elimination through the kidney. So in renal disease, tetracyclines accumulate to toxic levels. Now, Fanconi syndrome is a type of renal toxicity which is characterized by damage to the cells of the proximal tubule, and it is caused by the use of tetracycline preparations after the date of expiry. So expired preparations of tetracyclines can cause Fanconi syndrome, damage to the proximal tubular cells. Also, it has been reported that demiglocycline can induce nephrogenic diabetes insipidus, and this is due to blockade or inhibition of action of anti-diuretic hormone or ADH on the collecting duct. So since the ADH action on the collecting tubules is blocked, the water retention, water reabsorption property is blocked, and this leads to increased excretion of water in urine, leading to nephrogenic diabetes insipidus. So nephrogenic diabetes insipidus, which can be caused by demiglocycline use. The next adverse effect is dentition and bone defects. Now tetracyclines have the property of chelation with calcium. It forms complex, that is calcium tetracycline chelate complexes, which gets deposited in the developing bones and teeth. And this can cause staining of the teeth and retardation of bone growth. So retardation of bone growth and deformities in the teeth can occur because of the deposition of calcium tetracycline chelate complexes, and this can lead to deformities. So it should not be prescribed in pregnancy after the third trimester and in children below 10 years. The other side effects are increased intracranial pressure that is noted in infants, and also hypersensitivity reactions such as rash, urticaria, has been reported with the use of tetracyclines. So till now we have covered the classification, pharmacokinetics, mechanism of action, antibacterial spectrum, therapeutic uses and adverse effects of tetracyclines. Now speaking about Tigecycline, which is a new class of tetracycline analog, it is a glycyl cycline antibiotic. Some of the characteristic pharmacokinetic features of Tigecycline are: 1. They are poorly absorbed in the intestinal tract. The only route of administration is slow IV infusion. Secondly, Tigecycline has a large volume of distribution and therefore the duration of action is 36 to 60 hours. So it has a prolonged half-life unlike the other tetracyclines, and this is because of large volume of distribution. Thirdly, they are eliminated in bile, and since they are not dependent on kidney for elimination, dose reduction is not needed in renal disease. When it comes to the clinical use of tetracyclines, they are useful for treating infections that are caused by multi-drug resistant organisms including methicillin resistant staph aureus, vancomycin resistant organisms, gram-negative bacteria, gram-positive bacteria, streptococcus, pneumococci including anaerobes. Therefore, they are highly useful for treating complicated skin and soft tissue infection, particularly those that are caused by multi-drug resistant organisms. And also they are useful for treating complicated intra-abdominal infections, particularly intra-abdominal abscess or peritonitis, which is caused by gram-negative bacteria, gram-positive bacteria, anaerobes, that is polymicrobial infections, where tetracycline finds its use since it is a broad spectrum antibiotic. It is effective against wide range of microorganisms including the resistant organisms. So Tigecycline, the new class of tetracycline analog, it is used as a last resort antibiotic for treating severe resistant infections.